Hi, I'm Dr. Asim Farooq. I'm a GP in Croydon and Chelsea. Welcome to another edition of Doctor's Orders. We heard yesterday afternoon that the youngest victim to die without a known medical condition was only 19 years of age. He was an Italian chef from North London. But then later on in the evening, it was trumped by someone not far from me, a 13-year-old boy who died in King's College, London. Again, he had no medical conditions. He died alone. He wasn't able to see his family at the end. Now, this makes it very clear that this disease affects all age groups, not just the elderly. The elderly are at much higher risk, with much higher mortality, but everyone has to be careful. There is some positive news though. We heard that the Nightingale Hospital at the Excel Centre is almost ready to open. That should hopefully have 4,000 beds. We heard that thousands of ventilators have rolled off the production line, should be ready within a week or so. We also heard about Mercedes and the fact that their Formula One team managed to create a new type of CPAP machine within 100 hours. CPAP stands for Continuous Positive Airways Pressure. And this is something that can deliver air and oxygen into the mouth at a continuous rate, which will increase the amount of oxygen entering the lungs. And CPAP is very effective, has shown to be effective in Italy and China, and also avoids the need for ventilation. So this is all great news. We're hearing as well that Oxford University is developing similar technology. We're hearing about trials that are ongoing about anti-malarial drugs such as chloroquine, hydroxychloroquine, again showing some positive data. So hopefully all is not lost. But it's very important that we follow the government message, and that is very clear. You need to protect the NHS, and you're going to do that by protecting yourselves. Last time we talked about protecting yourself, and I reminded you that gloves and masks need to be used correctly, otherwise they may not protect you. But social distancing is very important. It needs to be implemented everywhere. And now when I'm walking around, I'm seeing it. Whenever I enter a shopping mall or want to buy something, we are implementing it correctly. We just need to make sure on the tube we're doing it properly too. In terms of the NHS, we must protect it. We need to take the pressure off those who are putting themselves on the front line for you all. It's really important that you utilize the information from the internet to get the advice that you need. Please do not inundate 111 also. If you think you have got symptoms of corona, you can easily use the 111 website symptom checker before you ring. Those of you who are ringing your GPs asking for isolation notes, these can also be downloaded from the 111 website as well. The message to us clinicians is quite clear. We need to save as many lives as we can, but we're not going to be able to save everybody. There are going to have to be some harsh choices made, some difficult decisions. Now, this may well affect us in the future psychologically, but right now we have to do everything we can, save as many people as we can. And there's many emotions that we all are facing. The common emotion, I'm sure some of you may feel, is fear. And while it's important you have some element of this, so we're mindful that we practice our social distancing, but we must not turn this into anxiety or panic or even worse, mass hysteria. There's a danger that there's other emotions we fear, even anger. We're cooped up, we're thinking about lots of things, we need somebody to blame. Sometimes we may even blame society, and we may even demonize those who did not practice social distancing properly, those who might have hoarded, those who did not listen to the government and the experts. Obviously it's important you do follow this advice as well as you can, but we must not demonize those people. Are we going to turn our anger to the government? Are we going to turn them to local leaders, accuse them of not being adequately prepared for this? Hindsight is a wonderful thing. Nobody could have really predicted what a devastating effect this virus would have. We all know what a pandemic means now, but until we really see it for ourselves, we cannot know. We're in an unprecedented situation now. I believe at this important time, we mustn't point fingers. It's important that we all step up to the plate. We need to do what we can. Remember about camaraderie. Camaraderie does not mean a difficult photo shoot. It's where we all come together in a difficult time and unite. What you can do for your community and for your NHS is very important. Have you asked about the welfare of your neighbours? Are there any skills that you can utilise to help us? Can you volunteer and help us? We've also heard about people stepping up to the plate. We've heard reports of local schools keen to do whatever they can, even donating goggles and equipment. We've heard about firms donating 3D printers to make masks. Everyone's doing their bit. I'm sure you can as well. Also, I want you to utilise the power of positivity and humour. Keep you in good spirits. Watching comedies can be useful. Make sure you're talking with your friends and family in a positive way. It's not a problem to tell jokes. I got a message today that the lockdown was coming to an end. When I opened it, I realised it was an April Fool's joke. I'd forgotten totally. Today is the 1st of April. So, today, why don't you have a laugh? Why not even play a simple April's Fool prank on someone you love, or maybe someone you don't love? Those are my doctor's orders for today. Thanks for listening to me.